Hello and good afternoon. I'm Dr. Sotiri Polidoru. I'm an associate professor of medicine and psychiatry at the Zucker School of Medicine, the medical director of addiction services for Northwell Health, chief of addiction medicine for the Division of General Internal Medicine, and the interim medical director at Wellbridge Addiction Treatment and Research Center.
Good afternoon, everyone. I'm Dr. Jean Morley. I'm an assistant professor at the Zucker School of Medicine and the Feinstein Institute for Medical Research. I'm also a primary care physician and a clinical researcher with my primary focus on the treatment of depression, anxiety, and alcohol use disorders within primary care.
Dr. Morley and I are very much looking forward to our conversation today about a topic that is both rather timely and relevant. Our session today is called Distilling the Facts, an analysis of alcohol benefits and risks. Alcohol use has been steadily rising in this country. Dr. Morley, can you tell us about general patterns of alcohol use and how they may have changed since COVID?
So thank you for the question, Dr. Polidoro. This is a great place to start. I think when each of us starts to think about the role that alcohol plays in our lives, it's really useful to have a context. If we look back historically since the end of Prohibition, our attitudes as a country towards alcohol have progressively become more accepting. Before the COVID pandemic, our patterns of alcohol use among adults have generally fallen into three major categories. In the middle is the largest group of us, those who drink somewhat regularly, but don't drink to excess and generally don't run into any trouble. Then there are those who don't drink at all, and that represents about 30% of us. On the other end of the spectrum, a little over 25%, 1 in 4 of us, are those who regularly drink above healthy guidelines. Now, alcohol use in that group is really on a continuum, from those who just drink like mildly at-risk drinkers, to those with mild to moderate alcohol use disorders, to those with serious addictions. And not surprisingly, as the level of drinking increases, so do the health consequences. Now, more recently, trends since the COVID pandemic started show a significant uptick in alcohol use, especially among women. Overall sales of alcohol have increased by about 50% during the pandemic, and online sales by a whopping 500%. Recent surveys show significant increases in alcohol use. However, the amount tends to vary from as little as 15% to as high as 60%, depending on who's being surveyed and how the questions are being asked.
Thanks, Dr. Morley. I mean, that's really helpful to, assist us in thinking about the continuum and the kind of historical perspective of how things have changed. Historically, though, heavy drinking has been usually more associated with men. However, alcohol use among women has increased since COVID. Can you tell us a little bit about that? Is this a new trend?
So you're quite right. Alcohol use among women has unfortunately increased during the pandemic, but the trend towards higher levels of drinking among women is not new. It really started about 20 years ago. In the 10-year interval from 2002 to 2012, there was a 15% increase in the proportion of women who drank, a 60% increase in heavy drinking among women, and that's compared to only about 16% increase in men, and even more concerning, an 85% increase in the diagnosis of an alcohol use disorder among women. More recently, in a survey just prior to COVID, 60% of men and just over 50% of women reported drinking in the past month, while 30% of men compared to 22% of women recorded binge drinking. Now, these numbers are just not that far apart anymore. So, although in absolute numbers, there still are more men drinking heavily than women, as you can see, the gap between the two has been steadily shrinking.
Thank you, Dr. Morley, for noting these changes. How has COVID impacted this trend in alcohol use among women?
So it's a great question. So alcohol use among all groups has increased during COVID. However, again, women have really disproportionately been affected. One recent study found that women have increased their heavy drinking days by 41% since COVID began. Now, turning to alcohol is a common socially acceptable response to coping during times of high stress. We've seen similar increases in substance use after other traumatic events, like Hurricane Sandy or 9/11. But the pandemic's been unique, both in its duration and in how profoundly our lives have changed. Much of the responsibility to manage the logistics of these changes have fallen on women, who often have to deal simultaneously with working from home, childcare, household responsibilities, homeschooling, financial pressures, just to name some. Compared with men, women have reported higher rates of pandemic-related stress, including changes in mood, sleep, productivity, health-related worries, and frustration with the isolation and the loss of social support. Women with children under the age of 18 reported the highest levels of stress. So there's no question, while we've all experienced hardship in the past 2 years of COVID, the higher levels of stress reported among some women and the increased access to alcohol during the pandemic have proven to be an unhealthy combination.
So important to comment on the different strain that so many have gone through, and really we've all gone through during COVID. There's certainly a difference between drinking to unwind at the end of the day in moderation, or to celebrate a special occasion, to drinking to cope with a specific event or stressors. Can you elaborate a little bit more on what might be considered a safer amount of alcohol to use? And then also kind of how excessive use can really impact you, both your physical health as well as your mental health.
Yeah, so I'm happy to clarify this. So healthy guidelines regarding alcohol use for women are not more than 3 drinks on one occasion and not more than 7 drinks for a week. And these guidelines are also true for men over the age of 60. Healthy guidelines for men are not more than 4 drinks on one occasion and not more than 14 drinks per week. Now, to really understand these guidelines, it's also important to understand what constitutes a standard drink, because it's not necessarily the size of the drink that matters, it's the alcohol content. So 1 12-ounce can of beer, 1 5-ounce glass of wine, or 1 shot of spirits, which is 1.5 ounces, all contain the same amount of alcohol and are considered a standard drink. Now, the higher we go above these guidelines, the greater the health consequences, including heart disease, liver disease, certain cancers, gastrointestinal issues like ulcers or gastritis or pancreatitis. Heavy alcohol use also increases risk of falls, motor vehicle accidents, domestic violence, and gun-related violence. In addition, heavy drinking can negatively affect mental health by worsening insomnia, anxiety, or depression.
So Dr. Morley, there is research that women are more susceptible at times to these negative health effects from alcohol due to some biological differences between women and men. Can you tell us a little bit, maybe that is why some of these guidelines are different, or how we can kind of interpret some of those changes, those differences specifically?
That's a question I often get asked by my patients. Because women absorb and metabolize alcohol differently than men, the guidelines for healthy drinking are different. However, there is a caveat, because even at weight-adjusted lower levels of exposure, alcohol consistently is shown to have more negative effects on women's health than on men's. Because women typically have less total body water and high total body fat, alcohol is more concentrated in women's bodies.
Are there any exceptions to some of these recommendations or general guidelines that you noted?
Yeah, I'm really glad you asked that question, because in some instances, there's no safe level of alcohol. For example, Women who are pregnant or trying to become pregnant should not drink at all. Women with cancers, such as breast cancer, or anyone with head and neck cancers, liver or colon cancer, lung cancer, shouldn't be drinking. And then people with liver disease, heart disease, diabetes should severely restrict their alcohol use or abstain from alcohol completely. And then there are certain medications that are just not safe to mix with alcohol, like pain medicines, anti-anxiety medicines, or sleeping pills, blood thinners, diabetes medicine, some antibiotics, and some blood pressure medications. So if someone's taking a medication and they're not certain if it's safe to drink or not, be sure to speak to your doctor or your pharmacist.
Thank you, Dr. Morley, for noting those important exceptions. Certainly there would be others that any person can speak to their physician about as well, but just noting a number of those exceptions is just really helpful to think about. In the circumstance where someone may realize that they are drinking in an unsafe way, perhaps they're finding it difficult to reduce some of their drinking. Can you talk a little bit about some of the treatment options for alcohol use disorder and what they might be in general?
Yeah, absolutely. So for anyone who has concerns about their level of drinking, there are both behavioral health interventions and medications that have been proven effective in the treatment of alcohol use disorder. There are 3 FDA-approved medications that can be given in both primary care and specialty care settings. And we also know that combining behavioral health support with medication improves the likelihood that people being treated for alcohol use disorder can both achieve and sustain their goals. Now, like high blood pressure or diabetes, alcohol use disorder is usually a chronic medical problem, so it really helps to think of it that way. Just as you'd expect to partner with your physician over years to manage your diabetes or your high cholesterol, alcohol use disorder is no different. That's why I think primary care physicians are in a unique position to be effective and compassionate partners in this kind of care. Many patients can safely manage their alcohol use disorders in a primary care setting. However, those with severe addictions or extremely heavy use would likely require more intensive treatment in specialty care settings. Now, Dr. Polidoro, given everything we've discussed so far, what do you make of the data that suggests modest amounts of alcohol can be beneficial?
Thanks, Dr. Morley. Yeah, that's a really important point that we can talk about and try to clarify. In some context, it's important to say that alcohol and other substances can have some limited beneficial aspects at times for some people, even though it remains, incredibly important that we can still appreciate the risks that are present as well. So while alcohol in some or limited amounts may possibly have some supportive evidence suggesting a cardiovascular benefit related specifically to heart attacks, we really should also recognize that that in itself is not the whole story of alcohol's effect on your body. It could be helpful to also keep in mind that even those studies that previously suggested there could be some benefit, the amount of alcohol consumed was rather small and limited. However, Dr. Morley, you mentioned this earlier, what is clear is that as drinking increases, the risks dramatically increase as well. And this evidence is very clear and consistent. The risks that have been identified include various cancers, so oral, esophageal, pancreatic, liver, breast, colon, lung, all would be kind of considered. Let me also note that, more recently, the American Cancer Society has identified that alcohol is one of the stronger cancer connections to specifically breast cancer. So over 10% of new breast cancer diagnoses are related to drinking alcohol. So really, since 2020, the American Cancer Society guidelines recognizes that even a single drink appears to increase the risk of cancer. So they have been advising complete avoidance of alcohol for cancer prevention specifically. So again, just different aspects for us to be considering. Other factors really to be reminded of as well, such as the risk of injury, and not just from accidents. So, but violence and suicide increases as well. So really, we should consider many factors, balancing both some of the benefits, but also the number of risks that we started to talk about.
So that gives us an awful lot to think about. Now, we've talked about what options are available in primary care. What about those seeking treatment for alcohol use disorder in a specialty setting? Can you tell us a bit about what the path to recovery looks like and how you help your patients?
Sure. So certainly each person's recovery is unique. It's important to recognize that we have many treatments, though, including specific medications that are currently available for various substance use disorders. So not just only alcohol use disorder, but others as well. And that our treatments work really as well as treatment for other chronic illnesses, like again, hypertension and diabetes. Also, like other illnesses, treatment can look differently based on the severity of the disease. So, as an example, for a person with a severe alcohol use disorder or another substance use disorder, there may be beneficial to have a period of being in the hospital or a residential setting, or more regular and frequent assessments at an outpatient or ambulatory specialty clinic. All of those different care environments may really be needed and supportive of a person's recovery. However, for many people who continue to stabilize, less frequent and less intense treatment can really be the optimal form of treatment that they need. So similarly to ongoing monitoring by your primary care provider. Also, similarly to other areas of medicine, more recently, the adoption of telehealth visits, particularly since the beginning of the pandemic, has been really widely implemented across not just medicine more generally, but even within specialty addiction centers as well. And that can be a really important way to access treatment during the pandemic and going forward. There's also a growing focus on the role of digital therapeutics as an additional avenue for receiving and connecting with treatment. So, our scientific understanding of substance use disorders, as well as a treatment option, has really continued to grow rather dramatically.
Oh, thank you. Now, along similar lines, just to build on this, what if it's not ourselves, but someone else we're concerned about? What signs can friends and family look out for to recognize if a loved one may be struggling with a substance use disorder? And then are there resources available to help them access care?
Great question, Dr. Morley. Yeah, that's an area that, all clinicians are faced with very regularly in terms of what kind of support is available, and not just uniquely to treatment of the person who may be going through that experience individually, but also their support system, family, friends, loved ones. So, the first step is really being aware if a person is using an addictive substance regularly, how it may be affecting them socially, their behavior, or their health. And, having an open, non-judgmental conversation about it is really an important step. There are certainly a number of resources available. There are national resources that are open and available to everyone. Some are available online, so findtreatment.gov, FIND treatment, TREATMENT.gov, or the National Helpline, which is a telephone number, 800-662-HELP. Again, 800-662-HELP. Both are provided by the Substance Abuse and Mental Health Services Administration and can help those personally looking into treatment options, as well as loved ones or family members interested in finding out about resources. Within New York State, There's a New York State resource that's also available by calling 877-8-HOPE-NY. So 877-8-HOPE-NY, or texting to HOPE-NY, and that number at HOPE-NY is 467-369. Additionally, Northwell offers a screening, brief intervention, and referral to treatment service. And that's available by calling 516-465-5955. Again, that telephone number is 516-465-5955.
Well, thank you for sharing all those resources with us. Can you suggest some things we all can do to better understand and support those who are struggling with substance use disorders?
Great question. I'd certainly recommend continued conversations like this, and suggest it's less about having all the answers, but instead it's about engaging in an open, non-judgmental way, and recognizing that treatment is available, accessible, and very effective.
Great. Well, thank you everyone for taking the time to join us today. We'd like to introduce now our colleague, Dr. Nizan Roth. She's the director of Women's Liver Health Program, who'll speak to you now about the impact of alcohol use on your liver. Thank you again.
Hi, my name is Nizan Roth. I'm a transplant hepatologist and assistant professor of medicine at the Donald and Barbara Zucker School of Medicine at Hofstra in Northwell, and the director of the Women's Liver Health Program through the Katz Institute of Women's Health. I'm going to talk to you today about how alcohol can affect the liver, and how we can try to prevent and manage alcohol-associated liver disease. I'd like to start off by just talking a little bit about the liver itself, my favorite organ. It really is a powerhouse within the body. It's responsible for over 100 different functions, and we don't have a way to replace it. There's no equivalent of liver dialysis if the liver fails, so it's an important organ to protect. It has jobs that include filtering the blood, storing a number of different substances in the blood, and also making a lot of very critical things for the body, ranging anywhere from storing glucose to making proteins and other clotting factors that you need. The liver is a smart organ. It's actually able to regenerate and heal itself when it gets injured by something, whether it's alcohol or something else. The problem and the challenge is that if injury continues, if there's ongoing damage to the liver that happens over weeks and months, and especially over years, eventually that can overwhelm the liver's ability to heal itself, and you can end up with permanent damage. So I'm going to speak a little bit more about how alcohol can be toxic to the liver. And without getting too technical, alcohol is directly toxic to liver cells. It leads to the development of fat within the liver cells. It also sets up a pro-inflammatory cascade, which leads to your body sending immune cells into the liver that then further attack and damage the liver cells. The alcohol also leads to effects on your digestive tract. So it affects the healthy bacteria and the balance of bacteria that live inside your intestines. It also can lead to more leakage of things like toxins through the wall of the digestive tract, and all of that can really exacerbate damage. Within a short time of binge drinking, or especially if somebody's drinking alcohol heavily over a few days or even a week or two, almost all the time, more than 90% of the time, there can be detectable fat that's indicating damage inside the liver, inside liver cells. The good news is that with quitting drinking, with alcohol abstinence, that fatty liver that comes from recent alcohol actually can be fully reversible within 4 to 6 weeks. So if somebody makes a mistake, drinks really, really heavily, and causes some temporary damage to the liver, your liver can really heal from that pretty nicely. But I like to make an analogy to patients that it's a little bit like if you burned your arm in the same place. So maybe the initial burn heals, and then you get a little bit of scar tissue, but it looks okay. If you keep injuring yourself in the same place, eventually you accumulate scar, and it doesn't look normal anymore. And the same thing happens in the liver. So when there's this ongoing process of damage and healing over the span of 5 to 10 years, people can end up with cirrhosis, which refers to when there's permanent scarring and a disfigured liver. And that's when you can start to have symptoms because of the liver not being able to keep up with its many important jobs, or because blood has difficulty flowing through the liver, and that leads to the symptoms of liver failure. Alcohol is also unique in that even if somebody doesn't have extensive scar tissue in the liver, even if the problem hasn't been going on that long, a lot of alcohol consumption all at once, truly sort of excessive amounts for the health, can lead to a short-term problem that's called alcohol-associated hepatitis. And that refers to sudden and tremendous fat and inflammation that can happen in the liver and even lead to liver failure. We see this sometimes in men and women who were previously healthy, didn't have any idea that they had any medical problems related to alcohol. But when the alcohol consumption has been really excessive and too much for their health, all of a sudden the liver can get very sick very fast. And that can be life-threatening. So I've spoken a little bit so far about all the ways that alcohol can be toxic and can lead to liver health problems. Let's talk next about what is a safe amount liver-wise. Does this have to be complete abstinence, or, can drinking in moderation be okay liver-wise? The truth is that it depends. You've already heard a little bit from my colleagues about how men and women metabolize alcohol differently, and that's very true. There are a number of other factors that also affect how much alcohol can be drunk safely. Some part of it's genetic. There's a number of mutations that have been identified by researchers that predispose people to developing alcohol-related liver disease. If you've had previous bariatric surgery for weight loss, for obesity, things like a gastric bypass surgery, that also dramatically impacts how alcohol is processed and absorbed into the body. And the risk of developing alcohol-associated liver disease is much higher and happens at much lower levels of alcohol consumption. The way that you drink alcohol also matters. It's not just a matter of amounts. So drinking on an empty stomach or while fasting, binge drinking, all of these patterns have a higher risk of leading to liver disease. If you have other coexisting liver conditions, whether it's viral hepatitis like hepatitis B or C, or what's really common in the US, which is metabolic fatty liver, so fatty liver that comes from non-alcohol related reasons, but things like obesity and diabetes, that can also really lower the liver's tolerance for alcohol. One little bit of good news in terms of things that can lower risk of alcohol-related liver disease, coffee consumption can help. So if you're a coffee drinker, great. And if you are drinking alcohol, consider having a cup of coffee along with that, or, near that time. But let's talk about some easy rules of thumb. So for women who are otherwise healthy, who don't have other forms of liver disease or any known liver disease, drinking up to 1 standard drink per day and no more than 7 standard drinks per week is a safe threshold where you're not going to develop any alcohol-related liver problems. For men, it's double that. So up to 2 standard drinks per day and no more than 14 in a week. However, if you do have risk factors for non-alcohol related liver disease. So if you have obesity, if you have viral hepatitis, if you're diabetic, if you have known liver disease, you may not be able to drink even the amount I just told you. And so a good rule of thumb is to cut that down by at least half. So maybe it's only one standard drink every other day. And for somebody that has prior bariatric surgery, likewise, half of what I said. So one standard drink every other day at most. If you're somebody who already has cirrhosis, who already has extensive scar tissue in the liver or serious liver disease, then unfortunately, it really should be total alcohol abstinence, because at that point, the liver really cannot do well with any amount of alcohol, even in moderation, and continued drinking can really lead to progression of liver disease, worsening symptoms, liver failure, and also it has a lot of very real implications in terms of whether somebody can receive a liver transplant if that ever were to become necessary. We've talked about a safe amount of alcohol that you can drink, or who can drink alcohol safely. Let's talk about how you can find out if you or a loved one has alcohol-related liver disease. Probably the most important thing to realize is that a lot of times there won't be any symptoms of alcohol-associated liver disease until it becomes very severe, until there's advanced cirrhosis, or until you have that disease that I mentioned, alcohol-associated hepatitis. Earlier stages of alcohol-associated liver disease, where there can already be fat, inflammation, and even scar tissue in the liver, are oftentimes symptom-free. So you really don't want to necessarily wait until you're having physical signs of liver disease. What are those signs that can happen when you have later stages of liver disease? Well, some of the signs can include things like jaundice, which is yellowing of the eyes or skin, swelling with fluid retention in the abdomen or in the legs, confusion, shortness of breath, or bleeding from the digestive tract. But like I said, we don't want to wait for those things to happen before thinking about liver health. Luckily, there's ways to check to see whether you have earlier stages of alcohol-associated liver disease. A primary doctor can check blood work that includes liver chemistries. That's done on routine blood tests. And if those liver enzymes or liver tests are elevated, it'd be a good idea to seek the advice of a specialist, a hepatologist, or a gastroenterologist. A sonogram or an abdominal ultrasound can also be a good way to look to see if there's any fat in the liver that's related to alcohol, or if there's any abnormal shape to the liver that suggests cirrhosis. Finally, I'd like to mention another tool that we have, which is something called elastography. And this is a non-invasive, non-painful technique that uses vibration waves through the skin using a wand that looks very much like an ultrasound probe. And it's used to see what the density is of the liver. A normal, healthy liver should be nice and soft, like a raw chicken breast, or like a piece of liver that you'd find in the supermarket. On the other hand, if there's a lot of fatty inflammation in the liver, or if there's scar tissue in the liver, then those measurements of the density of the liver become thrown off and the liver becomes harder. And that measurement can tell us when we need to worry that somebody really has some ongoing damage in the liver that we want to work to try to reverse. All of these tests that I mentioned can often be done before you even are referred to or see a specialist. So it's relatively easy to get this checked by your primary doctor if you or a loved one are worried that you're drinking an amount of alcohol or were drinking an amount of alcohol that's above the thresholds that I mentioned to you that are safe for the liver. Finally, I'd like to talk about treatment. And it's important to recognize that at any stage of alcohol-associated liver disease, we do have treatments available. It is never too late to work on and improve your liver health. For people that have early stages of alcohol-associated liver disease, where it's mainly just fat or maybe some fat and inflammation in the liver, and at most only a little bit of scar tissue, that can be fully reversible, meaning curable completely, oftentimes with just stopping to drink alcohol. So when I see patients who have early alcohol-associated liver disease, the focus of my treatment is mainly on helping them to try to abstain from drinking or to moderate their drinking. This is where the work of my colleagues, Dr. Sateri and Dr. Morley, becomes so critical as well. And we really partner along with their teams. For patients who do have more advanced stages of alcohol-associated liver disease, including cirrhosis or alcohol-associated hepatitis, stopping to drink can actually still lead to some reversal of disease. So I've had many patients who start off incredibly sick, jaundiced, and with all of the different symptoms and signs of liver failure that I mentioned to you. And while it can be life-threatening in some people, I have had some patients where with the right supportive care and with stopping to drink, they can have dramatic improvement in their liver disease and resolution of a lot of those symptoms. Sometimes we need to help that along with medications. In particular for alcohol-associated hepatitis, when you have that sudden onset of liver failure, medicines such as steroids given in the hospital or at home can be helpful in reducing that inflammation in the liver and giving the liver time to try to heal itself. We're also involved with clinical trials for other experimental therapies to try to help that disease and save people's lives. And finally, even patients who have cirrhosis or advanced stages of cirrhosis where we can't hope to necessarily cure the disease anymore, we still have the option of liver transplantation. And that could really be life-saving and life-changing for a lot of people who have struggled with alcohol. So again, I just want to emphasize that it's really never too late to think about your liver health, to try to moderate your alcohol consumption, to look into getting screened for alcohol-associated liver disease if you're worried that you've been exceeding safe amounts of drinking for the liver, and to get help from a specialist if you think you need treatment to try to help your liver health improve. Thank you so much for letting me speak to you today. It was my pleasure.
Thank you.